Good evening, I'm Michael and you're watching Kini News, the show that brings you today's biggest stories. Yesterday, the Health Ministry reported the highest single-day spike in new cases. Today, it reported the lowest number of new cases in 10 days. As of 12 p.m. on March 24th, 106 new cases have been reported. This means Malaysia now has a total of 1,624 COVID-19 positive cases. In a press conference this evening, Health Ministry Director General Dr Noor Hisham Abdullah also revealed that one new death was recorded, bringing the total death toll to 15.
Kes kematian ke-15 merupakan kes 1,519. Lelaki warga negara Malaysia berumur 70 tahun. Beliau mempunyai penyakit kencing manis dan darah tinggi dan disyaki mempunyai sejarah kontak dengan kes positif COVID-19 iaitu kes kes 703 ataupun 703 semasa solat Jumaat.
With over 900 of the total cases linked to the Sri Petaling tabligh gathering, some have reacted with anger towards the group. However, Dr Noor Hisham said today that the group should not be discriminated against.
Untuk makluman umum, merujuk kepada jangkitan COVID-19 di kalangan jemaah tabligh, iaitu kadar jangkitan adalah 60% daripada jumlah keseluruhan. Dan janganlah kita persalahkan jemaah tabligh. Janganlah kita diskriminasikan jemaah tabligh. Janganlah kita stigmakan jemaah tabligh. Apa yang penting adalah kita membantu mengesan dan mengawal jangkitan COVID-19 di kalangan jemaah tabligh dan kontak mereka.
A week into the movement control order period, Dr Noor Hisham also stressed why it's important for Malaysians to stay at home.
Okay, our action now is everybody have a responsibility, and this is unprecedented for the government to implement MCO, that means the movement control order. This is the first time we are doing it, and it's the period of 1 week is rather short for us to access. But more important is that we intend to break the chain of transmission of the virus. If everyone stay at home, that's a message that we want. Stay at home. For every individual, stay at home. Wash your hand, distancing yourself. That you will help Ministry of Health to break the transmission of the infection. And that's the reason why we have this MCO in place.
Malaysians have nothing to worry about if they see armed military personnel at roadblocks because the people are not the enemies, according to the Chief of the Armed Forces. Armed Forces Chief General Afandi Buang responded to comments by some people who questioned why military personnel were armed at roadblocks during the enforcement of the movement control order. He said only some of the army personnel is armed with weapons for self-defense during the roadblocks.
Tak ada, kita bawa senjata untuk self-defense. Kalau kita tengok dalam 5 orang dekat situ, seorang je bawa, kan? Kita bukan gunakan senjata. Macam saya tekankan semalam, kan? Selamat Pagi Malaysia, saya beritahu, kan? Rakyat bukan musuh kita, kan? Cuma kita memantau, kan? Musuh kita sebenar ni adalah coronavirus tu, kan?
Afandi added that he was satisfied by the operation carried out by his men on the ground. He said this after inspecting drones which will be used in 12 hotspots around the country at the Brickfields Police Headquarters this afternoon. The police and army will be using the drones to monitor the public's compliance with the MCO. It's been almost 1 week since the movement control order has been in place. So far, the police have taken the soft approach, but soon that could change. Despite the movement control order being in place for almost 1 week, there are still those outside with no valid reason. The police, through hundreds of roadblocks and checks across the country, have been advising people to stay home. However, according to Senior Minister Ismail Sabri Yaakob, the approach may soon change.
Seperti yang saya perjelaskan baru-baru ini, semalam dan kemarin, bahawa pihak polis mungkin akan mengubah cara mereka. Bukan setakat nasihat, tetapi tindakan undang-undang juga akan diambil kepada mereka yang menghalang penjawat awam dan juga yang masih berdegil dan gagal untuk mematuhi arahan ataupun nasihat yang dikeluarkan oleh pihak polis.
However, several investigation papers have already been opened over the non-compliance with the MCO.
Dari segi statistiknya, sebanyak 695 laporan polis telah pun dibuat, 46 kes sedang disiasat, dan di mana kertas siasatan telah pun dibuka untuk 46 kes ini, dan yang ditangkap seramai 28 orang setakat ini.
Meanwhile, as payday approaches, for many employees, the government is anticipating large crowds at banks and has put plans in place.
Oleh itu, kita menjangkakan akan berlaku kesesakan di bank dan juga di ATM machine. Jadi kita semua menyeru supaya jangan berpusu-pusu di bank ataupun di ATM, dan kita juga akan minta kepada pihak polis dan juga tentera jika perlu untuk mengawal di kawasan-kawasan bank dan sebagainya dan juga ATM, supaya pematuhan kepada penjarakan sosial itu juga dilakukan.
Soon, Malaysia will be roping in foreign allies in its fight against COVID-19. Wisma Putra is seeking the assistance from foreign governments to combat the COVID-19 outbreak. Foreign Minister Hisham Hussain said Malaysia is in talks with the Chinese government for medical experts to be sent here to help the country's frontliners. He said following the discussions, medical experts from 26 hospitals in Malaysia will also hold a video conference with their counterparts in China this Thursday to share best practices and strategies in the fight against the virus. Hishamuddin added that the government has also contacted the United Arab Emirates for assistance with regard to medical equipment.
We are talking specifically about medical equipment, critical medical equipment, and I believe that UAE has got some capability to help us in that respect. At the same time, UAE also has certain needs that maybe Malaysia can fulfill, and this is still pending negotiation.
It's important to take necessary precautions to protect you and your family, but some may be overdoing it, thus taking away supply and equipment from those who really need it. Health Ministry Director General Dr Noor Hisham Abdullah has reiterated that members of the public need not wear face masks unless they display symptoms of COVID-19 or are on the front line dealing with patients.
Basically, from WHO, that you only need to wear a mask when you have symptoms, for example, or you are taking care of patients, for example, COVID patient, etc. Or, the requirements if you have been working in the hospital environment and facing the public. But generally, if there's, social distancing is more than enough for, not necessary for you to wear a mask. But some of us overdo it, for example, you want to wear it despite, the advisory being given. Yeah.
So can authorities, arrest you for it, for not wearing masks?
No, advisory, as I said.
There has been confusion on whether the use of face masks by the public is mandatory. Previously, the Health Ministry and the National Security Council, the main authorities overseeing the nation's crisis management, as well as various local governments, have issued seemingly conflicting instructions on the matter. This is in spite of the fact that many quarters have expressed concern over the limited supply or shortage of face masks throughout the country, especially for frontline staff battling the disease. With the movement control order, some of you may worry how you're going to spend your time and how to get rid of boredom. Others are scrambling to find ways to feed themselves. Our reporter Shazwana Amir has more.
At this block of low-cost flats in Cheras, a third of the families hail from the embattled Chin state in Myanmar. Sangbet is one of them, and he runs a refugee school on the ground floor of the flats. Following the implementation of the MCO, the school has stopped operating. But on the day of our visit, a few Chin refugees had stopped by this classroom to pick up food donated by Good Samaritans during this difficult time. For the refugees here, they would rather fend for themselves when they can, and that's what they have been doing all this while. They took up odd jobs at restaurants and construction sites to support their families until the MCO stopped them.
Some of the family start speak to me. How can I manage to pay for rental? I have no job, no income, and food and drink for children. How to do, I don't know, no idea.
As the COVID-19 outbreak worsens, Sangbet is also worried about his community, which does not have access to subsidized healthcare.
Because most of my people, they cannot work at a permanent job. And job, what they do was not guaranteed and not safety, and the pay is very less compared to the local. Some problem at the work site, some people not provide salary at all by the boss.
The food on the table here is sponsored by Picha Eat, a catering company that hires refugee chefs to support the community.
For us, definitely we are also affected because 65% of our sales usually come from corporate orders, and with all the events cancelling, which we understand that it has to be cancelled, a lot of our chefs has been badly affected because their income comes from the sales.
Picha Eat is now appealing to the public for funds to enable them to give free meals to refugees, stranded university students from the B40, as well as frontline healthcare workers.
It's really a time for us to see whether the whole world is caring enough for one another, where those who can afford reach out to those who can't to really help them out a little.
According to the UNHCR, Malaysia is home to some 178,990 refugees and asylum seekers. However, the country does not officially recognize refugees and regards them as undocumented migrants. Shazwana Amir, KiniTV.
Coming up next, with 1.3 billion people, COVID-19 could be a disaster if it spreads in India. That and more after this. This next story is brought to you by Blue Air. The usually bustling streets of New Delhi were silent on Monday as the street was put under lockdown in an attempt to keep citizens indoors and to prevent the spread of COVID-19. India announced a halt on flights and said the majority of the country was under complete lockdown in an attempt to stop the spread of the coronavirus as the number of deaths rose in the region. India has reported 471 cases, but health experts have warned that a big jump could be imminent, which would overwhelm the underfunded public health infrastructure. On Monday, India confirmed 2 more deaths, bringing the total to 9. The government ordered commercial airlines to shut down domestic operations from midnight on Tuesday and banned international flights. In the capital, New Delhi, streets were deserted and offices shut at the start of the lockdown, which runs until the end of the month. Public transport was also suspended after thousands of people, mostly migrant workers, swarmed train stations to go home. In a Twitter post, India's Prime Minister Narendra Modi said many Indians were not taking the lockdown seriously. He wrote, quote, "Please save yourself, save your family, follow the instructions seriously." According to medical experts, a lack of testing facilities could be hiding the true extent of cases in India, which has a population of more than 1.3 billion people. And that is all from me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll see you again tomorrow, same time, same place. I'm Michael. Thank you for watching.